The Addiction Treatment Center, which is part of Kuwait Center for Mental Health, helps recovering patients of illicit substance abuse through various programs. The Continued Care Unit, known as the CCU, is part of the Outpatient Department, and it is the final stage of the rehabilitation process. Sarah Glubb has this special report on the recovery and rehabilitation process and the group support sessions.
The Addiction Treatment Center has been helping drug and alcohol abusers with their comprehensive and well-established programs and activities, and one such example is the group rehabilitation sessions.
I'm responsible for the continuing care unit here. This is the third stage of treatment. After the patients get through the detoxification program and they get the pre-rehab program, it's supposed that the patient will be transferred to the halfway house, and the halfway house is really related to the program of outpatient program. The outpatient program is a structured outpatient program. It's the program which is responsible for enhancing the motivation for the treatment of the patient, for the patients. Also, it is responsible for the relapse prevention program, making a self-improvement, educating the patients all the recovery dynamics which is related to his dealing with his disease, because it's one of the most important issues for the addict patients after being prepared for the treatment, is to get through a structured intensive program that must continue for at least 1 year, to be in a very structured and in a very systematic way. He must attend to us daily through the continuing care program and the OPD program. When it started at the beginning, it was just 2 days a week. Now we have a structured outpatient program which is daily. It's already begun to reduce a lot of patients who are already in recovery and got the result of the recovery, because we are focusing on the recovery approach, not the harm reduction approach. We are dealing with the patients who should be abstinent completely from taking all the drugs and taking all the substances. We are educating them how to handle and cope their lives without drugs. We are trying to educate them also and prepare them just to recognize all the weakness points that they have related to the relapse, because they have to be educated also how to cope and how to prevent themselves from the relapse, because we are dealing with a disease which is a dangerous, fatal, progressive, chronic, relapsing disease. So it's one of its aspects already, it's the relapse. So the patients must be trained to cope with the relapse.
This is the final stage of the recovery process, where patients can hear from those who have suffered from these same experiences and learn more from them, although their journey is far from over.
Now, in this stage, he would learn what are the behavior of addiction, why he is an addict, and why he is continuously seeking the illicit substance. So in this step, they will learn to identify the behaviors that keep them on with their addiction problem and how they can deal with it. And through the phases of this program, then they would come to the level where they would reach the full control of their problem. When they reach this step, which might take 6 months for a patient and might take 2 or 3 years for another patient, we don't know. We can't actually figure out which patient would need 6 months or those patients who would need 2 to 3 years. We are drug-free center. That means we do not give replacement therapy. We try to help the patients through sessions and through encouraging and increasing their motivation. We don't give any substances to alleviate the withdrawal state or to help them to keep away from the medication.
The care plan begins with a thorough assessment and evaluation process that produces a thorough individual treatment plan for each patient. The center ensures that recovery occurs on the physical, emotional, mental, and spiritual levels. These sessions that are organized by the Addiction Treatment Center are the final step in the recovery phase to enable these people who possess an unbelievable amount of strength in overcoming this affliction to step back out into the world. From the Addiction Treatment Center, this is Sarah Glubb reporting for English News.